Come in.
Good evening, Mr. Nicotine. My name is Dominique, and I'm going to be your student nurse today. I need to wash my hands. Okay. Can I see your hand? Okay. Can you tell me your whole name and your date of birth for me?
Morgan Dill Nicotine 61191.
Okay, thank you. What we're going to be doing today is we're going to be doing your physical assessment. We're going to start from your head to your toe. The first thing that we're going to do is your head, your face, and your scalp. I'm going to start with your scalp. Okay, looks like it's clear of any lesions or infestations, which is good. The next thing I'm going to do is palpate your sinuses. I'm going to start right here in your frontal. Let me know if there's any pain or discomfort.
No.
Now I'm doing your maxillary.
No.
Okay, that's good. The next thing I'm going to do is your auricles, which are your ears. Just let me know if there's any pain or discomfort.
No.
Okay. I don't see any lesions. Let me check for some discharge. Okay, I don't see any discharge or serum blockage, so that's really good. Next thing I'm going to do is check your eyes. I'm going to check your conjunctiva first. And whenever I check your conjunctiva, I'm going to pull down on your lower eyelid and have you look up for me. Okay, that's pink and moist, so that's good. And I'm going to check your sclera. I'm going to have you pull up on your upper ones and you're going to look down for me. Okay, that's white and moist, so that's very good. Next thing I need you to do is I'm going to point this eye into your eyes. Okay. Now if you'll follow my pen light. Okay, that's good. Now if you look at the end of this pen, look at the wall behind me, then look back. Okay, that's good. Your pupils are round and reactive to light, and they also accommodate. The next thing I'm going to do is inspect your nose. And making sure that your septum is midline and that your mucous membranes are pink and moist, which they are, so that's good. Okay, would you mind flaring your nostrils for me? Okay, they flare symmetrically, so that's good. Now, so I'm going to check the patency. Okay, what I'm going to do is close one nostril and you're going to sniff with the other one. Okay, that's good. They are clear. Next thing I'm going to do is check your mouth. So if you open your mouth for me, if you stick your tongue out, do it back side to side, and say ah.
Ah.
Okay, that's good. Your mucous membrane's pink and moist. Your tonsils are intact. Your soft palate's pink and moist. Your lips are pink and moist. Your gums are pink and moist. Your teeth are white and in line. And I didn't find any lesions, so that's very good. Next thing I'm going to do is check your neck. Your trachea is in line, and I don't notice any enlargement in your thyroid, so that's good. The next thing I'm going to do is osculate your carotid artery on both sides. Okay, I didn't hear any bruising, which is good, because if I heard any bruise, that means that there'd be a narrowing or blockage of your artery, and we wouldn't want that. The next thing I'm going to do is inspect and palpate your skin on your interior thorax. I'm just making sure that your skin is the same as the rest of your body, which it is, so that's good. Making sure that there's no lesions or edema, which I don't see any. And I'm also checking your temperature to make sure that there's no moisture, which there isn't. The next thing that I'm going to do is I'm going to put my hands on your chest, and if you'll breathe in for me. Okay, that's good. Your lungs rise and fall symmetrically. What I'm going to do is I'm going to osculate your lungs. There's 8 spots I'm going to listen to. Okay, they sound good. They're free of any bronchi or crackles. The next thing I'm going to do is teach you about a breast exam. Do you do monthly breast exams?
No.
Okay. Well, they are important. Even men can get breast cancer, especially if breast cancer runs in your family. So what I'm going to do is teach you how to do a monthly breast exam. The best thing to do is you're going to do it at the beginning of the month. And the best place to do it is in the shower. So what you're going to do is you're going to raise up your arm, put your hand behind your head, and then with your other hand, you're going to start at your axillary, and you're going to go in a circular motion around your breast until you get to your nipple. And once you get to your nipple, you're going to squeeze it and see if you get any discharge. Whenever you're doing your monthly breast exams, if you ever notice any discharge, have any pain, or lumps, then you need to contact your physician immediately. The next thing I'm going to do is inspect your cardiac, which is your heart, which is found in the 5th intercostal space. Well, between the 2nd and the 5th intercostal space. Okay, I'm going to palpate to see if I see any visual palpation, which I don't, so that's good. The next thing I'm going to do is osculate your heart and your valves. Right of the sternum is your aorta in the 2nd intercostal space. Left of your sternum in the 2nd intercostal space is your pulmonic. Left of your sternum in the 3rd intercostal space is your herbs. Left of your sternum in the 4th intercostal space is the triopsid. Below that in the 5th honor case is the mitral. And then since I'm listening to your heart, I'm going to go ahead and listen to your apical pulse. It's in the 5th intercostal space left of your clavicle line. Okay, everything sounded good. It's free of any murmurs or dysrhythmia. Next thing I'm going to do is check your posterior thorax, which is your back. I'm going to inspect it. Okay, if you'd breathe in for me. Thank you. Your lungs rise and fall symmetrically, so that's good. I'm going to make sure that your skin is the same as the rest of your body, which it is, so that's good. I'm also going to check your temperature to make sure that there's no moisture, which you don't have any. And the next thing I'm going to do is listen to your 10 lung fields. Okay, they sounded good. They were free and clear of any ronchi or crackles. Now I'm going to check your spine. Okay, that looks good. What I was checking for is scoliosis or kyphosis, but you don't have it, so that's really good. Okay. The next thing that I'm going to do is inspect your and palpate your upper extremities. Okay, they look free and clear of any edema or lesions. So the next thing that I'm going to do is check your capillary refill. It was less than 3 seconds, so that's good. Stay with this. I don't see any noticeable clubbing or anything like that. I'm going to check your skin tour. It's elastic, and that's very good. I'm going to check your temperature to make sure that there's not any moisture, which there isn't, so that's very good. Okay, the next thing that I'm going to do is do your brachial and radial pulse. They're both bilaterally symmetrical, so that's very good. The next thing I'm going to do is check your strengths. So if you push down on my hands, okay, if you push up on my hands, okay, that's good. Now we're going to do your range of motion. If you'll just do what I do, we're going to do flexion, extension, abduction, and adduction. Okay, that looks good. So the next thing that we're going to do is your abdomen. So if you lay down for me. If you would breathe in for me and breathe out. What I was checking for to make sure that there wasn't any enlargements or masses, which I didn't see anything, so that's very good. Next thing I'm going to do is osculate in all 4 quadrants. I'm going to start with your left lower quadrant, your left upper quadrant, your right upper quadrant, and your right lower quadrant. What I was checking for is for hyperactive, hypoactive, normal, or absent listen to the sounds, and all your sounds were normal. I heard them in every single quadrant. If I didn't hear any sounds, I would listen for 5 minutes in each quadrant until hopefully I did hear something. The next thing I'm going to do is palpate in all 4 quadrants. Okay, what I was looking for was any enlargements or masses, which I didn't find anything, so that's very good. The next thing I'm going to do is your lower extremities. Okay, your skin is consistent with the rest of your body, so that's good. I'm going to check your temperature. There's no moisture or anything, so that's very good. I'm going to check the capillary refill in your toes. It's less than 3 seconds, so that's very good. Now we are going to do your strengths. If you push down for me, if you push up for me. Okay, now we're going to do your range of motion, flexion, extension, abduction, and adduction. Then I do the same thing with the other foot. I also wanted to check to make sure that there were no lesions or edema, which there isn't any, so that's very good. And now I need to do your dorsalis pedis pulse, which is right here on top. And then I'm going to do your posterior tibial pulse, which is right inside your foot. Okay. And that will be all for your physical assessment if you want to put your shoes on. Have a good day.